Magnesium. It's one of the first things seniors reach for when foot cramps start waking them up at night. But that tablet sitting in your medicine cabinet, the one you've been trusting for weeks, maybe months, may be part of the reason the cramps keep coming back. And it's not because you're not taking enough. It's because something about the way you're using it is silently working against you. 5 things, actually. 5 mistakes that most seniors over 60 never realize they're making. And the 5th one, the last one I'll show you today, is the one that changes this entire conversation. Let me tell you what most people believe. They believe that if the bottle says magnesium, and they take it every day, the foot cramps should ease up. Makes sense. The label looks right. The price feels fair. You're doing the responsible thing. However, and this is where it gets serious, the NIH Office of Dietary Supplements states clearly that not all forms of magnesium are absorbed equally. Some forms dissolve well and move into your system. Others barely get past your gut. A 2017 randomized clinical trial published in JAMA Internal Medicine tested magnesium oxide, the most common form seniors buy, against a placebo in adults with nocturnal-like cramps. The result? No significant difference. The magnesium group did not improve more than the group taking a sugar pill. That's not a small detail. That's the foundation cracking. You trusted a bottle. The bottle looked right, and the cramps kept coming. My name is Dr. David Collin, and after 60, everything changes, and most people aren't told why. I'm a senior wellness researcher specializing in leg cramp relief, magnesium nutrition, and supplement safety for adults over 60. And I made this video because there's a gap between what seniors are sold and what actually reaches their muscles. This is for educational purposes only. Always discuss changes with your own doctor. But what I'm about to walk you through is something I'd say to my own family member sitting across from me right now. If this kind of information matters to you, and I believe it will, subscribe so you don't miss what comes next. I cover the things most seniors are never told, and that matters after 60. Here's what you'll know by the time I'm done. You'll understand exactly why one magnesium bottle can disappoint, why another can quietly backfire, and how to think about foot cramp relief more carefully than anyone has ever explained to you before. You'll also know the one red flag that tells you this may not be a magnesium problem at all. So let's start with the first mistake, and it's the one almost everyone makes. You walk into a pharmacy, or you open a website, and you see a wall of magnesium bottles. They all say magnesium. They all have numbers on the front. 300 milligrams, 400, 500. You pick the one that looks strong. Maybe it's the cheapest. Maybe it's the one your neighbor mentioned. You bring it home. You start taking it. And you wait. But here's what nobody told you. The word on the front of that bottle, magnesium, is only half the story. The other half is the word after it. Oxide, citrate, glycinate, chloride. Those words are not decoration. They are the difference between a supplement your body can actually use and one that passes through you like water through a screen door. Stop. Listen to this carefully. The NIH Office of Dietary Supplements, this is the United States government's own nutrition research arm, says it plainly. Forms of magnesium that dissolve well in liquid are more completely absorbed in the gut than less soluble forms. Magnesium aspartate, citrate, lactate, and chloride tend to have higher bioavailability. Magnesium oxide and magnesium sulfate? Lower. Now think about that. Magnesium oxide is the form you'll find in most drugstore bottles. It's cheap to manufacture. It packs a big number on the label, and it is one of the least absorbed forms your body can receive. It's like filling your car with a fuel that looks right at the pump but burns at half the efficiency. The gauge says full. The engine still stalls. That's mistake number 1. Assuming every form of magnesium works the same inside your body after 60. It doesn't. Your gut absorbs less as you age. The NIH confirms that magnesium absorption decreases with age and renal excretion increases. So not only are you starting with a form that's harder to absorb, your body is already working with a narrower window. So why do so many seniors say they tried magnesium and still wake up with their foot locking at 2 in the morning? Because they were never told this. They followed the label. The label was incomplete. And that leads directly to mistake number 2. Trusting the front of the bottle instead of understanding what your body can actually use. Here's what I mean. You see a bottle that says 500 milligrams of magnesium oxide. That sounds like a lot. More than the bottle next to it that says 200 milligrams of magnesium citrate. So you grab the bigger number. Obvious choice. But milligrams on a label don't equal milligrams in your muscle. What reaches your bloodstream depends on the form. What reaches your muscle tissue depends on whether the form dissolves well enough for your gut to pull it in. A 2019 study published in the journal Nutrients tested 15 different magnesium products and found what they called a very wide variation in absorption and dissolution across the products. Wide variation from the same mineral. This is the trap. The supplement aisle is designed to make you trust the biggest number. But the biggest number on the front doesn't mean the biggest benefit inside your body. Cheap. Popular. Wrong. That's what I see over and over again. Seniors doing the right thing, reaching for help, and the system giving them a bottle that looks correct but delivers less than they need. Your doctor never told you this, but I will. Now, here's where this gets more serious. Because mistake number 3 isn't just about wasting money. It's about making things worse. Some forms of magnesium, particularly the oxide form and a few others, are known to have a laxative effect. The NIH notes that high doses of magnesium from supplements often result in diarrhea, accompanied by nausea and abdominal cramping. The forms most commonly reported to cause diarrhea include magnesium carbonate, chloride, gluconate, and oxide. Now, if you're a senior taking magnesium for foot cramps and the supplement upsets your stomach, what do? Most people either cut the dose in half, which may drop it below any useful level, or they stop taking it entirely. But here's the part nobody connects. If that magnesium is causing loose stools, you're not just uncomfortable. You're losing fluid. You're losing electrolytes. And when you lose fluid and electrolytes, particularly at night, when your body is already running on less hydration, what happens? The cramp cycle continues. Or it gets worse. The supplement you took to stop the cramps may be quietly feeding the exact conditions that trigger them. That's not a side effect you shrug off. That's a feedback loop. And most seniors never see it because no one draws the line between the loose stool in the morning and the foot cramp at 3 a.m. Most seniors never connect this to that. Today you will. Now, mistake number 4 is the one that moves this conversation beyond the supplement aisle entirely. Because this is where your medicine cabinet meets your magnesium bottle, and the two don't always get along. If you take a water pill, a diuretic, your doctor prescribed it for blood pressure or fluid retention. But here's what you may not know. The NIH states that chronic treatment with loop diuretics like furosemide and thiazide diuretics, like hydrochlorothiazide, can increase the loss of magnesium in urine and lead to magnesium depletion. Read that again in your mind. Your blood pressure pill may be draining the very mineral you're trying to replace with a supplement. And if the supplement you're using is a poorly absorbed form, you're trying to fill a bathtub with the drain wide open. But it doesn't stop there. If you take a reflux pill, a proton pump inhibitor, something like omeprazole or lansoprazole, this next part matters more than anything else I've said so far. In 2011, the FDA issued a drug safety communication, a formal public warning, stating that long-term use of proton pump inhibitors can be associated with low magnesium levels, hypomagnesemia. And in 25% of the cases the FDA reviewed, magnesium supplements alone were not enough to fix it. The patients had to stop the PPI. So imagine this. You're taking a reflux pill every day. It's quietly lowering your magnesium. You're taking a magnesium supplement to help your foot cramps. But the supplement is a poorly absorbed form. And your gut, altered by the reflux pill, may not be pulling in what little it can. That's not one mistake. That's 3 mistakes stacking on top of each other. And the NIH goes further. Magnesium can form insoluble complexes with certain antibiotics, tetracyclines, and quinolones. It can interfere with bisphosphonates, the drugs many seniors take for osteoporosis. Even thyroid medication like levothyroxine needs to be separated from magnesium by hours. This is why I keep saying, after 60, everything changes. The same supplement that's fine for a 30-year-old can become a complicated puzzle for someone managing 3 or 4 prescriptions. And yet the label on the bottle says nothing about any of this. The big enemy here isn't any one company. It isn't your doctor. It's the system itself, the one-size-fits-all supplement aisle that treats a 70-year-old on 3 medications the same as a 25-year-old training for a marathon. The information never caught up, but you deserve the real answer. Now, before I get to the 5th mistake, and it's the most important one, I need to ask you something. I want you to drop a letter in the comments right now. If you still believe any magnesium bottle is basically the same for foot cramps, drop the letter A. If you believe the form, absorption, and your medication list matter more than the front label, drop the letter B. I read every single comment personally. Let me know below. And now here's the part I've been building toward. Everything I just told you is real, and it matters. But there is something that changes all of it, something almost no one talks about. And once you understand it, you will never look at that magnesium bottle the same way again. The fifth mistake is the most dangerous one. And it's not about choosing the wrong form. It's not about ignoring your medication list. It's about assuming that every recurring foot cramp you're having is a magnesium deficiency in the first place. Here's what I mean. A 2020 Cochrane systematic review. The Cochrane database is considered the gold standard for evaluating medical evidence. Looked at 11 randomized controlled trials on magnesium for skeletal muscle cramps. 5 of those trials focused on older adults with idiopathic nocturnal leg cramps, the exact kind that wake you up at night with your foot seizing. Their conclusion? And I'm going to say this slowly because it matters. It is unlikely that magnesium supplementation provides clinically meaningful cramp prophylaxis to older adults experiencing skeletal muscle cramps. That was their word. Unlikely, based on moderate certainty evidence. That does not mean magnesium is useless. Some seniors do report improvement, particularly when they were genuinely low in magnesium, when the form was well absorbed, and when the context around it was right. But what this research tells us is that for many older adults, the cramp is not a simple magnesium shortage. It's a delivery failure. The form they chose may not reach the muscle well enough to matter. The gut may not be absorbing what's given. The medication they take every morning may be draining what the supplement puts in. Or, and this is the part that changes everything, the cramp pattern itself may not be primarily driven by magnesium at all. It could be a potassium issue, a sodium imbalance, a hydration pattern that drops too low overnight, a vascular issue, a nerve compression, a medication side effect no one flagged. There is a long list of things that cause foot cramps after 60, and magnesium is only one entry on that list. This is for educational purposes only. Always discuss changes with your own doctor, especially if you have kidney disease, if you take diuretics, PPIs, thyroid medication, or antibiotics regularly, or if your cramps are getting worse, are one-sided, or started suddenly after a medication change. Do not guess. Talk to your doctor before adjusting anything. The NIH is clear that the risk of magnesium toxicity increases with impaired kidney function because the kidneys lose their ability to remove excess magnesium. The National Kidney Foundation advises people with kidney disease to be cautious with supplements in general, and magnesium is no exception. Mayo Clinic guidance says magnesium supplements should be safe as long as you have healthy kidney function. That qualifier is not a detail. It's the whole point. I'm telling you this because nobody else in this space will. What if the problem is not low magnesium, but magnesium that never reaches the muscle well enough to matter? What if the real issue is that you've been solving the wrong equation? That's the twist most seniors never hear. The supplement aisle says the answer is a bottle. The research says the answer is context. Which form? Which medications? Which other minerals? Which hydration pattern? Which cramp pattern? The bottle is one piece. The picture is much bigger. Most seniors never get this far. They manage one piece of the puzzle, but they miss the delivery failure. And that gap is exactly what keeps the problem returning night after night. So here's what you do with everything I've just told you. First, look at the form of magnesium you're taking right now. Turn the bottle around. Read the back. If it says magnesium oxide and you've been taking it for weeks without improvement, that form may not be the best match for your body after 60. The NIH data points towards citrate, lactate, chloride, and glycinate as forms that tend to be more completely absorbed. Talk to your pharmacist. Talk to your doctor. Ask about the form, not just the dose. Second, watch for gut intolerance. If your magnesium is giving you loose stools, do not ignore that. That's not a minor inconvenience. That's your body telling you it's not handling this form well. And the fluid you're losing may be working against the very cramp relief you're chasing. Don't just push through it. Third, review your medications and your kidney history before you change anything about your supplement routine. If you're on a diuretic, your magnesium may be leaving your body faster than the supplement replaces it. If you're on a PPI, a reflux pill, the FDA has flagged that as a risk for low magnesium after long-term use. If you have any kidney concerns at all, magnesium supplementation needs medical supervision. Period. Not random. Not harmless. Not forever. Fourth, do not isolate magnesium from the rest of the cramp picture. Food intake matters. Hydration matters, especially overnight. Potassium and sodium balance matter. A 2016 cross-sectional study of over 500 primary care patients aged 60 and older, published in BMC Family Practice, found that 46% suffered from cramps and 31% reported cramps that woke them from sleep. The causes were tangled, vascular issues, medications, dehydration, electrolyte gaps. Not one bottle, a web. So to be clear, magnesium is one thread in that web. It deserves attention, but it doesn't deserve blind trust. This is not age. This is something your body is doing, and we can fix it, but only if we stop guessing and start looking at the full picture. And fifth, if your foot cramps are persistent, happening multiple times a week, or if they're one-sided, newly severe, or tied to a recent medication change, move from self-guessing to medical review. The supplement aisle teaches seniors to ask, which bottle? But the smarter question after 60 is, why is this cramp happening in the first place? That question changes everything, because the answer might be magnesium, or it might be something a bottle will never fix. Let me bring this full circle. You clicked on this video because you're taking magnesium for foot cramps and something still isn't right. Now you know why. The form matters. The absorption matters. The gut tolerance matters. Your medication list matters. And the assumption that every foot cramp is a magnesium deficiency. That's the most dangerous mistake of all. After 60, foot cramp relief is not about taking more magnesium. It's about making sure the right form, the right context, and the right safety checks are working together. That's what separates blind supplementation from informed decision-making. And that's what I wanted you to leave this conversation with. Magnesium is not useless, but blind magnesium use is. Now that you know why magnesium can fail, there's something else happening in your body that can keep foot cramps coming back even when your magnesium choice is better. And it has everything to do with what your body is losing at night. Your nighttime electrolyte balance. Most seniors are getting this wrong right now. Today, I cover exactly that in the next video. Watch it now.